I want to take you back in history because in 1991, more than 20 years ago, I and a group of colleagues at the University of Sydney were commissioned by the Australian government at the time to review and then revise Australia's national health goals and targets as they existed at the time. And over an 18-month period, we worked on what we thought was a quite visionary and rather radical set of proposals for health goals and targets in Australia that included the conventional goals and targets relating to preventable mortality and morbidity and healthy lifestyles, reducing health risks in the population, but also included proposals for two new major areas of national health goals and targets. Those were for the creation, promotion of healthy environments, and a whole chapter of the report on health literacy. And just for historical interest, you may see there that we defined health literacy more than 20 years ago as the ability to gain access, understand, and use information in ways that promote and maintain good health. Reassuring that 20 years on, we're still broadly in the same territory. Secondly, in terms of the three goals for health literacy that we promoted at that time, the first was to very clearly align the improving health literacy of the population as fundamentally dependent upon levels of literacy in the population. So our first goal was to align health to literacy in the population. And then two more broadly based goals that were largely about using literacy, using health literacy in this case, to enable people, in one case, to make informed choices about their health, and in the other case, to bring about changes in the environments that shape their health. Any of this familiar? 20 years on? So it was published to great acclaim, I have to say, and launched by the then Australian Health Minister, Brian Howe. And I have to say, as a publication, it remains among my most highly cited publications. Progressively, a week after the report was launched, the government of the day announced that there would be an election. The Health Minister, Brian Howe, didn't survive the election, and neither did our recommendations for a radical change to the nation's health goals and targets. And indeed, what happened was a progressive narrowing of those national goals and targets to focus only on preventable mortality and morbidity. And health literacy basically disappeared without a trace in terms of public discourse in Australia for about a decade, basically, before it began to re-emerge again in the early 2000s. I say all of that because it provides context for how wonderful it was to read Andrew's report of what's going on in the world. I'm familiar with what's happening in the United States, and it was great to see how health literacy has taken off around the world. And in terms of our appraisal of where we are now, well, I have two immediate emotions. Firstly, I'm genuinely delighted to see that health literacy has taken off around the globe, that we have, I think, a far better appreciation of the nature of the relationship between literacy and health. I think we, as you'll see during the course of the day, a much more sophisticated understanding of the importance of informed choice, of patient engagement, of community engagement, and of the role that literacy and health literacy can play in empowering people to do things that will improve their health. On the other hand, I have to say, I'm also rather worried. The frank truth is, health literacy has become rather fashionable. It's become rather politically fashionable, and often I've seen it represented in ways personally I don't recognise, and as a panacea, as we say here, for many ideals and ambitions that we have for the healthcare system. Now, my concern about this is that this is exacerbating what we've already seen as some conceptual confusion. And in this sense, I'm worried, although enthusiastic, I'm worried that this conceptual confusion might actually hold back the future advancement of science and the translation of our science into policy and practice. Now, where do we go from here? Well, I think we need to do three things. Firstly, we need to sort out some conceptual confusion and some of the potentially competing paradigms. I certainly accept there's an alternative view that we should let 1,000 flowers bloom, but as I say, there are some real risks associated with this. I think we already know quite a bit and clearly are learning more from outstanding studies like the European survey that we've heard about today. So we need to put into practice what we already know. This is about knowledge transfer as well as new knowledge generation. And then finally, and I think again, Jürgen and others have made a very clear case that we need to more systematically and more collaboratively address the challenge of measurement. And I might say, I prepared these slides before I knew what Jürgen was going to say, but the conclusion is exactly the same. Now, I've only got 10 minutes, and I have about another 25 slides. So what I'm going to do, those slides are going to be available and people can refer to them. I'd like to talk about some issues related to conceptual confusion. I was going to talk a bit more about what I think health literacy is, as opposed to what it's not. But I'll skip that bit. You can read about it if you're interested, and go on to some concluding remarks. It's always a mistake to ask me to speak for 10 minutes, by the way. I'm actually genetically incapable of doing so, but I will do my best. So, what about the conceptual confusion? Now, I want to be a little bit provocative here. This is the final session. This is a good time to start having some debate. So I'm going to propose to you that health literacy is not an action. And I personally get frustrated when I hear health literacy used in phrases as though it's something we do. In my view, health literacy is an outcome. Ilona described it earlier as one way of describing the kind of outcome that we're looking for from health promotion interventions. It's either an outcome or it's a status measurement, as is literacy. We don't do literacy. You use literacy as a measure of outcome or a measure of status. What we do is we educate and we communicate. I think it's really important to get that differentiation sorted out. Health literacy, just like literacy itself, is an outcome. It's a status measure. It's not an action. Education and communication are actions. There's also been some conceptual confusion about the relationship between language and literacy. Occasionally, a confusion that because somebody doesn't speak the predominant language of the country or a community, then they have a health literacy problem. Actually, what they have is a language problem. And the solution to it, and they may well be very literate in the language that they speak at home, highly literate in the language that they speak at home, but not good at the predominant language in their community or their country. Now, it's translation and interpretation services are what's needed here. This is not a health literacy problem. It's a language problem. The third conceptual confusion that I would observe is that there is this fundamental relationship between literacy and health. I often see the two conflated, and I don't think we should. Some people are literate and some people are not literate. And then there are relative measures of literacy. Some are more literate than others. And what we know is that on a population basis, there is a direct relationship between literacy and health status. And it's one of the reasons why I indicated earlier that 20 years ago, we very clearly recognised that we needed to link our interest in health literacy to improving general literacy in the population, but we shouldn't confuse the two. One is a social determinant of literacy, is a social determinant of health. Then, I suppose, where I'd like to finish this little bit about conceptual confusion, a slightly more provocative proposal, and that is that there is actually a difference between what I've referred to here as health-related literacy and a distinct concept of health literacy. And the health-related literacy means that people who enter, for example, the healthcare system with low general literacy will often have problems with the system and problems in responding to what the system might demand of it. And this is more to do with the impact that low literacy may have on an individual's ability to engage successfully with the healthcare system. It's a deficit to do with general literacy rather than a distinct and positive concept of health literacy. And here the response needs to be, well, you need to identify individuals who have low general literacy, and we need to both modify the way we communicate with them and the environment in which we expect them to interact with our health decision making. And where that leaves me is proposing health literacy as a distinctive domain of general literacy that is both content and context specific. You can assess it in both absolute terms or in relative terms, and importantly, it can be built and improved through educational interventions across the lifespan, and as we have heard regularly, can obviously be supported through a supportive environment. Now, I'm going to skip the rest of this slot, but for those of you interested, the slides will be online, and it's a discussion about what can we learn about health literacy by an examination of health literacy. And the point is that literacy can be examined in relative terms. There are different skills levels, and health literacy can be considered in the same way. And I make the point that literacy is both content and content specific. So there are many forms of literacy, many different literacies, and health literacy can be seen as one of those. And that health literacy in and of itself is contextualized by age and stage of life. And again, we've heard that in the last few days. And again, I'll encourage you, if you're interested, to have a look at that. So where does all that leave us? Firstly, in terms of what we know, and I have to say again, great credit to the Institute of Medicine for all of the work that it and other organisations have done in order to capture what we know about health literacy. And where we are in our sciences, we have good evidence derived from research in clinical settings which have linked poor health-related literacy with a range of clinical outcomes. We've also learned from outstanding work done by a number of individuals, particularly in the US, that the rapid assessment of health literacy is feasible in normal clinical settings. And there have been some very good and increasing number of intervention trials in clinical settings to show both the potential effectiveness and cost savings that can come from interventions which take account of differences in health-related literacy. Outside of the clinical setting, there's promising, but as yet largely undeveloped intervention research in settings such as schools, in adult education, and in E, and how I've learned in M. Learning. Where do we go to here from research? Well, I think you heard a great response from Jürgen in relation to that, and I can only agree with what he said. But for me, the focus has to be on intervention as much as anything else, and I think we need to continue to broaden and test different types of intervention designed to build health literacy in a population. I think there is great potential, and we heard that this morning and throughout the day, for E and M health initiatives. And importantly, we've heard some great examples, both from Europe and also, I'm aware, in Australia, of measures of health literacy, and in the US, particularly thinking about the HALS and some of the other measures that are being developed, that incorporate a much wider set of skills and capabilities. In terms of where we go from here in clinical policy and practice, well, I'm not going to rehearse all of this. I think you're all aware. We need to promote understanding among clinicians. We actually need to recognise that it requires different forms of education and communication methods that are often common in clinical practice. And as I think you've heard on many occasions, we've got to have service management organisation that's literacy sensitive. And finally, where to from here in public health policy and practice, again I make the point, this fundamental relationship between general literacy and health literacy in the population. Something we've heard very little about today, and that is the really important role that school health education can play in building a foundation for future health literacy. The need for us to exploit where I think there are real opportunities for educational interventions in healthcare, for example, antenatal education, patient education, chronic disease management. And finally, we've heard a couple of examples of opportunities for health literacy through adult education.